Can doctors be understood? Find out by watching this video till the end. Don't go nowhere. Dr. Elemile, how are you today?
Fine, thank you.
You're welcome again to Dr. Dami Medic TV.
Yeah.
Okay, there seems to be increasing levels of mistrust of patients for their doctors, or let's say the healthcare team generally these days. So we'll be starting a series on patient-doctor relationship. It seems to me that although there are many reasons why this mistrust can be there, and one particular reason which we're going to talk about today is ineffective communication. And we all know that communication is the bedrock of any relationship. So if we're not able to communicate effectively, this mistrust will happen, and at the end of the day we see increasing levels of mortality and morbidities. In family medicine, there's a concept called the patient-centered clinical model, which is just talks about how we can, center around the patient. Gone are the days where we practice the paternalistic type of care, where everything is centered on the doctor. The doctor gives calls the shots, gives the final say. Everything is just about the doctor. But right now, it's all about the patient. And do patients even know this? First of all, that care is just about them. It's about them at the end of the day. It's not just about the doctor. But let's go back to the communication thing that we're going to talk about. As surgeons, it's generally known that surgeons are very blunt. Madam, you have breast cancer, and if you don't take it out in 6 months, you're going to be dead. Is that not so? But from feedbacks, I've noticed that you seem to be able to get through to your patients. So do you have some tips for us?
Yeah, surgeons are blunt. Yes, we are blunt.
You're blunt.
Yes, by virtue of what we do.
Okay.
We are blunt. But you have to be effective.
Effectively blunt?
No, you have to be effective in taking care of your patients. There's no point in saying you are blunt and all your patients are running away from you.
Mm-hmm.
One thing you must know in patient care is that, like you mentioned, it's patient-centered. It's whatever the patient decides. Meaning that you make a diagnosis, you lay all the options on the table, and then the patient decides what they want. The patient decides that the option they want is no treatment. Just nicely let the patient know that, well, this no treatment thing you are doing.
These are the consequences.
If you say, doctor, regardless of what happens, I don't want a blood transfusion.
Okay.
So be it.
Yeah.
So be it. Especially if you are at the age where you can take those decisions yourselves.
Okay.
As doctors, we have different tricks to try and make people change their minds. But it must be done nicely. So like the example you gave, a patient has this condition, you don't just say, remove that thing now if you know you are going to die. Even if you know the patient is going to die.
The doctor is telling the truth. Why can't he just, or she just tell it as it is?
No, so there's a place of, there should be an human face to anything.
Yeah.
Even sometimes when you want to punish a child severely, you must still nicely let the child know, oh, this is why I'm punishing you. Or you punish the child 1 minute and you give the child something else, a gift the next minute. So they know it's not because we hate you or something.
Okay.
So for patients,
speaking about it seems like doctors are the enemies now.
Yes,
the enemies.
Yes, it's because of this kind of things.
Because we are not able to effectively communicate.
So we have many situations where you have people that are not doctors,
okay,
who mismanage patients,
and
the patients are pleased with them.
They are pleased with them. In fact, when things go wrong, they don't go back to those people to go and fight.
They don't fight those
It's
people.
the doctors or the healthcare team that they fight.
I've seen situations where someone is not trained to do surgery on the patient. The person goes ahead and does the surgery. There's a complication. They then bring the patient to a standard hospital where all the doctors are running up and down, and the patient dies.
All right.
And you know what? They are forgotten where the complication arose from.
Wow.
They are only they are fixated. Yes, they are fixated on you, who has been doing everything to make sure they survive. So it means that along the line there has been a break in communication, such that you are running up and down, but they are not seeing it. I've seen situations where you perform a procedure for a patient to keep them alive, but the relation says it was that doctor put something in the mouth. They put something in her mouth. Why they put something in her mouth? Is that thing they put in her mouth that killed her?
Oh my goodness.
This is the importance of communication. So when I see patients, like I say, I'm usually quite liberal with them. You know, I listen to their fears.
You're speaking family medicine. You're using family medicine terminologies.
Yes.
All right, right on.
And then I would try and let them know that yes, those fears you have, they are valid. You know, those constraints are valid. I mean, some patients who want to do something because they feel, oh, I'm not married. What's going to happen if I get married?
Exactly.
So you have to be able to pass information such that the patient understands that right now, marriage is not the most important thing.
Yeah.
It's not about you just saying, no, you will die. No, it's not about, because, you know, like I also say, nobody knows when anybody will die. People die crossing the road on the express.
Yep.
Nothing is wrong with them. So if you say somebody who has probably a terminal disease, you say the person is going to die in 6 months. What about the person, even speaking to the person? Do you know if you are going to live up to that 6 months?
Yeah.
So which is why we have the knowledge. I think sometimes the knowledge pushes us to just want to dish it out. But you have the knowledge. Put the knowledge forward in a nice way. Let the patient understand that this doctor really cares about me, and whatever they are saying is for me. So that we can stop hearing things like the doctor said this, but they put God puts the doctor to shame or something like that. There's nothing like that.
Yeah.
Because it is simply what we, you know, it's almost like you are building a house.
Yeah.
You use bad things to build the house. What's going to happen? That is going to collapse.
Yeah.
Yeah. So without mincing words. So which is
if
why
that foundation of communication is already faulty, whatever you build on it, I wanted to reiterate that whatever you build on it is not likely going to stand, because that foundation is faulty. All right.
Yeah. So because the question I have now is, can doctors ever be understood?
Yeah.
Yes, doctors can be understood. But it has to be both ways. The doctors generally have to improve the way they communicate.
All right.
Communication, if you travel outside the country, there's a way they communicate. They give all the information, and that's because sometimes if you don't tell the patient is going to die in 6 months, or if you tell the patient is going to die in 6 months and he doesn't die, it's trouble. Because you know he has sold all his stuff because he says he's going to die in 6 months. So you know, you have to have a way of, you know, trying not to put yourself in the place of God, even though you have a lot of information that makes you look God-like, right? But don't put yourself in the place of God. Listen to what the patient has to say. Put forward the options and allow the patient to choose.
Decide what they want.
Whatever they decide. You say, well, I'm always available for you if you decide to change your mind. Now, let it be clear. Let it be written. Yeah.
And if you are not comfortable with the decision that the patient has taken, you can refer.
Exactly. That's very, very important.
Very important.
For example, if it's a life-threatening condition.
Exactly.
And a patient says, I don't want this treatment. Especially if you are not at the highest level of the healthcare facility.
Yeah.
You know, you are in a secondary center, refer to a tertiary center. Or a private center.
Or a private tertiary center even. Oh, would that be correct?
You know, generally, tertiary centers are okay. Because if anybody is, at least they know
that's okay. This is the highest cadre of care.
That they would have told you everything. Okay. But if it's at a secondary center,
please just
send the patient off. And it's common with obstetric cases.
Yeah, but I wanted to just wrap it up this way.
Okay.
That patients usually come to your consulting room with an agenda. They have an agenda. You have an agenda. By the time you're clerking them and all that, you have an agenda. There has to be a common ground that would be reached. The patient shifts, the doctor shift, because you have to put this patient is not just a thing. There are contextual factors surrounding the patient. So a patient has diabetes. A 40-year-old who develops diabetes is different from an 80-year-old who develops diabetes. At 80, retired, widowed, a 40-year-old who is still active, a workforce. The way you are going to manage the two patients, counseling, there are basic ways you know how to manage type 2 diabetes, but you have to put in perspective the context, of this patient. So you shift the patient shift, you find a common ground, and you communicate. Communication is communicate nicely. Let us learn not to place ourselves in the position, just like as you said, position of God. Risks must be communicated effectively also. So our next discussion will be on patients, having life-threatening conditions and they blatantly refusing care. How to navigate that? Maybe the next time will come on, but that's what we'll be discussing. The things that we can do in such an instance. I hope you have learned one or two things. Any final words?
Summary is, yes, doctors can be understood. So it comes from a place of us having all the knowledge. The patient has very limited knowledge, and sometimes knowledge is false because they gain those things just from browsing the internet, asking neighbors.
Mouth to mouth.
Yeah, because imagine you know something, the patient knows something about a condition just by reading the internet. The doctor has studied for several years that same thing and knows the ramifications of that thing. So don't believe as the patient that you know everything that the doctor knows. You don't know many things. Even if you have all the theories in your head, you don't know the applications of those things. So patient understand that you don't know enough. Doctor understand that you know so much, but you must still be able to communicate.
Yeah, nicely.
So nicely. So be able to get across to the patient, and then usually they would understand. Some patients will still never understand.
Yeah.
And
no
then
matter what you do,
you leave them alone.
Exactly.
And leave the lines of communication open, such that even if anything happens, they would know that but the doctor truly told me. I was the one that said no, I didn't want that.
Thank you very much. This is Dr. Dami, Med TV. I hope you've gained one or two things. Watch out for the next series on doctor-patient relationship. Please click like, share, subscribe. We'll be bringing interesting discussions your way. I am Dr. Elemile Oluwadam Lola Blessing. I'm a family physician and a lifestyle physician. And I have with me Dr. Elemile Peter, who is a general surgeon. God bless you. Till next time. Bye.
Bye.
Bye.